Bismillah ar-Rahman ar-Rahim. Today I will speak about an important issue in clinical practice, which is therapeutic failure or a lack of adequate therapeutic intervention in clinical practice. And the commonest causes of therapeutic failure is one of two things. Either diagnostic errors or mistakes or what we call clinical inertia. First, as regards the diagnostic errors or mistakes and their implications in therapeutic failure or lack of adequate therapeutic response is that the diagnosis of the exact clinical problem or the disease is either inadequate or incomplete. Because as we all know, if there is no diagnosis, there is no treatment, or if the diagnosis is not correct, the treatment will be incorrect, or if the diagnosis is incomplete, the treatment will be insufficient and there will be inadequate therapeutic response. Which will of course affect the prognosis of the case, because this is a whole continuum in the clinical management process. So the diagnostic errors or diagnostic mistakes, they is common, or we can say it is the commonest cause of therapeutic failure. In any category of pathology, infections, neoplastic pathology, degenerative pathology, vascular pathology, autoimmune pathology, granulomatous pathology, hereditary, or any underlying pathology. If you could not recognize the exact underlying cause and the exact underlying disease, and you could not trace the pathobiological basis of the disease, you will not be able to treat the disease properly. So the diagnosis or the diagnostic errors or mistakes will result in incomplete or inadequate diagnosis. The diagnosis may be inadequate at all, wrong diagnosis, or the diagnosis may be right but not complete. The physician did not address the whole situation of the underlying pathology and or could not recognize any comorbid conditions in the case or any complications of the disease, especially in the context of chronic medical diseases like diabetes, like hypertension, like asthma, like epilepsy, like migraine. Any chronic medical disease, important to address the pathobiology, it's important to address any comorbid conditions, it's important to address any complications, because all of these are goals for treatment. And in order to apply what we call the evidence-based standards for care or evidence-based goals for care. So the inadequacy of the diagnosis and incomplete or improper diagnosis will result in therapeutic inadequacy or lack of therapeutic response and therapeutic failure, diagnostic errors. The other issue is the clinical inertia, and the clinical inertia is the in fact, in many situations, the enemy of therapeutic failure. If the diagnosis, this is after or if we consider that the diagnosis is complete and is adequate, and the physician recognized and could pick up the correct diagnosis and the whole issue of the definite diagnosis of the case and its complications and comorbid conditions, and he started to treat or to manage pathobiologically based, not symptom based, because the basis is pathobiologically based therapeutic approach, not symptom based therapeutic approach. We do not treat symptoms, we treat disease. as the basic clinical fact in clinical medicine. We treat diseases, not symptoms. Only exceptionally, if we could not recognize the disease, the physician or the healthcare provider will manage the symptoms, at least in order to improve the life of the patient and to improve the what we call the functions of the individual, functional improvement, if he could not address the exact disease and the exact pathology and treat the underlying cause of the problem and the underlying disease. So it is disease oriented, not symptom oriented. The clinical inertia is the inability to initiate or intensify or change medicine in the proper time in a patient not at evidence-based goals or standards for care. This is the definition of clinical inertia. Clinical inertia is the lack of or inability of intensification, and to be more broad spectrum, to initiate. If the patient and if the physician already initiated, he is not able or was not able to intensify treatment in the proper time. And this is the basis of what we call the initial combination therapy and the intensification of treatment from the beginning in order addressing more than a pathobiological mechanism in the disease, in order to manage the disease properly from the beginning at the time of diagnosis without any delay, in order to prevent or at least minimize the incidence and severity of possible complications of the disease. This is the basis and the philosophy of intensification of treatment. So the lack of or inability of intensification of treatment in a patient not at evidence-based goals for care, this is clinical inertia. And the clinical inertia, it might be from the physician side, and we call it physician inertia, or the patient side, we call it patient inertia, or therapeutic inertia in the initiation of the drugs. And this might be related to many factors. One of these factors might be related to the patients, that is the socioeconomic standard of the patient unable to pay, the patient unable to afford for his treatment, because the treatment is expensive for the patient. So the patient is reluctant to start the new treatment. He knows his disease, he knows he is updated or she is updated by health education and by patient education about the medicine and the updated medicines in his disease, but he is not able to afford, because he is a poor patient, for example, and cannot buy the suggested and the prescribed medications. Especially in our issue today, many of the new effective medications, like for example the breakthrough in medical practice and in the pharmacological world, biologic therapy. The biologic therapy is a breakthrough in many chronic diseases now, and most of the biologics, if not all, are very expensive medicines. The most of or the biggest sector of patients who are poor are not able to pay, even in the developed countries. And here we come to the patient side. Or problems may arise from the insurance companies or from the what we call the payers in the healthcare system. So it might be related to the physician or to the patient or to the healthcare system and the controllers of the healthcare systems, especially the private sector in the healthcare system, controlling the payment processes and the support of the medical issues in the society and in the government. This is the clinical inertia issue. Thank you so much, and I will continue talking in further episodes about the therapeutic failure.